Today we are covering mood disorders, a topic where the NCLEX tests your ability to prioritize safety and recognize life-threatening complications. The exam often presents scenarios distinguishing between major depressive disorder and bipolar disorder. For depression, look for key terms like anhedonia, which is the loss of pleasure, along with significant changes in sleep and appetite. For bipolar disorder, the focus is on mania, characterized by elevated mood, racing thoughts, and poor judgment. An exam question might ask you to identify the patient most at risk. A patient with mania who hasn't slept in 3 days is a higher physiological priority than a depressed patient who is refusing to participate in group therapy. Pharmacology is where the most critical points are scored. While SSRIs, like fluoxetine, are common, the NCLEX loves to test on their most dangerous risk. A frequent exam trap involves the initial phase of treatment. When a patient starts an SSRI, their energy often returns before their mood lifts. This creates a high-risk window for suicide, as they now have the energy to act on suicidal thoughts. Your priority intervention is always monitoring for and directly assessing suicide risk in the first few weeks. Next are the MAOIs like phenelzine. These are older drugs, and the NCLEX focuses almost exclusively on their dangerous food interactions. Consuming foods high in tyramine while on an MAOI can trigger a life-threatening hypertensive crisis. A common exam question will list a patient's meal choices. You must identify the unsafe option. Here's a mental shortcut to remember what to avoid. Think of a fancy party platter. These patients must avoid foods like aged cheeses, cured meats like salami or pepperoni, smoked fish, and red wine. If a patient on an MAOI complains of a severe headache, you must immediately assess their blood pressure, as this is a primary sign of a hypertensive crisis. For bipolar disorder, lithium is the key medication. The NCLEX requires you to know its narrow therapeutic range, typically 0.6 to 1.2 milliequivalents per liter. The most important concept is recognizing lithium toxicity. Exam questions will describe a patient's symptoms, and you must identify toxicity and the correct nursing action. Early signs include fine hand tremors, nausea, and polyuria. Severe toxicity presents with coarse hand tremors, confusion, ataxia, and blurred vision. If you see these severe signs, the priority is to hold the next dose of lithium and notify the provider immediately. Finally, let's discuss suicide risk assessment. This is the ultimate safety priority. The NCLEX will test your ability to be direct and therapeutic. If a patient makes a vague statement like, "I can't go on anymore," the best nursing action is to ask a direct question such as, "Are you having thoughts of harming yourself?" Do not choose passive options like, "Tell me more about that." For a patient experiencing mania, safety is also key. A classic NCLEX intervention for a manic patient who is too active to eat is providing high-calorie, portable finger foods and drinks they can consume on the go. Reducing environmental stimuli by providing a quiet space is another priority intervention over trying to force them to join a group activity.